Hi everyone, this is Dr. Shama Mohan, Oral and Maxillofacial Surgeon, working in Nano Hospitals, Holimau. After initial assessment of the patient and the casualty, we look for other injuries of the body, and if that is cleared, we come back to the facial fractures, facial injuries, and we look for any possible cuts in the scalp or on the face or on the neck which is contributing to the bleeding, and what is the depth of the lacerations or the cut which needs to be sutured in layers, because for every patient the face is the most important part which gives them confidence. So the closure of these wounds need to be done in a very meticulate and elegant manner, and these lacerations need to be closed with very precise manner. So we look into that part, and then we examine the eye for any possible injuries, any problems in the movements of the eye or any blurring of the vision, and then we come back to any bleeding from the nose or any fractures of the nose. Then we look for possible problems in the opening of the mouth if the patient has any, and we look for any fracture of the teeth or fracture of any of the bones inside the mouth, if there is any mobility or movement of any of the bones inside the mouth, and then we send the patient for further evaluation by imaging. So we do X-rays or CT scans and also 3D reconstruction of the CT scans to also educate the patient, to show them what are the possible fractures that are there in their face, and educate them so that they can go ahead and understand what treatment can be done in them. Then after these evaluations are done, we discuss the possible treatment with the patient.